Hi everybody, let us today try to understand a little bit about fibroid uterus, which is the commonest benign tumor of the uterus. Meaning, it is a tumor which is seen in almost 40 to 50% of the women. A woman goes to a scan center and they say it is a fibroid. Do we have to be worried? No. Since it is a commonest tumor, only when the symptoms are there, that's when we are worried and we do something to decrease the symptoms. What are the symptoms? A woman can present to a gynecologist with increased bleeding PV or pain during menstruation, or it can be difficulty to conceive or just the mass in the abdomen that it is obscene to look at. There are so many other symptoms which can present like obstruction, so stopping the urine because of the pressure on the bladder. Sometimes the pressure itself can be the reason for the fibroid, or it can be a recurrent pregnancy losses like abortions, preterm labor, etc. So if a symptomatic woman comes to us, we do assess them. We understand the hemoglobin status of the woman because of bleeding. Second, we also do a scanning, ultrasound scanning, which is the commonest thing done, which will tell us about the location of fibroid, where exactly is it, and is that the reason for her symptoms. So once we understand that is the reason for it, that's when we can give them the option of treatment options. So always talk to your doctor about the causes and what are the treatment options. It can be minimally invasive techniques or just the medical management if the fibroid is outside and not the reason and only bleeding is the problem. So what are the treatment options we have? Depending on the age of the patient, we give a call. If there are multiple fibroids and patient has finished her children and more than 40-45 years, that's when the permanent cure, that is hysterectomy, is given. But otherwise, we do have other techniques like minimally invasive surgery, that is laparoscopic myomectomy, or if it is near the cervix, vaginal myomectomy, or it can be an open myomectomy, that is abdominal myomectomy. And apart from it, you do have some ablative techniques which are not so useful for infertility patients, like uterine artery embolization or MR guided ablative techniques, FUS what we call it, or also there are so many other ablative techniques which are coming in today's time. But simply put, medical management which is given to decrease the size of fibroids do not work much, does have side effects, but medical management given to decrease the bleeding in the form of hormonal treatment or intrauterine devices are good, but minimally invasive techniques like laparoscopy or a robotic, where it's a day care surgery, literally patient comes in the morning, we do the surgery and the next day patient goes home, is the best technique to remove the fibroids. So please talk to your doctor about all the options which you have.